2020 finally in our rearview mirror. We're here to 2021 now. Chances are you've been thinking, maybe I shouldn't go to the doctor's office, or I shouldn't bring the kids to the doctor's office, just to save ourselves from COVID. Just can I be sure, be safe? What you're actually doing, though, is possibly causing an issue with your kids' health. You want to make sure that they're getting their immunizations up and updated. You want to make sure that they're getting their well visits and making sure that they're catching anything really early. And if you're not doing that, well, now's a good time to start doing that.
That's right, Sean. It is absolutely essential. And here to talk about children's wellness is Dr. Arethusa Kirk. She's the Chief Medical Officer of United Healthcare. She joins us this morning all the way from Maryland. Doctor, great to see you.
Wonderful. Thank you so much for having me.
Great to have you.
Absolutely. My co-host knows this well because he has two kids under 3 years old. But let's talk about the importance of children's wellness and why it's so important for all parents and family members, guardians to be informed.
Yep. Thank you so much. COVID-19 has really brought wellness and health to the forefront of all families, to our nation. And here at United, our goal is to help people live healthier lives. We are here to amplify the message that the American Academy of Pediatrics and the American College of Family Physicians has put out, which is really get our kids back in for their preventive wellness checks.
Mhm.
2021 is a great time for us to really think about what we're going to do to empower ourselves with our health.
Yeah.
And that obviously starts with our families as well. So, one of the things that's really on top of mind for families is with COVID-19 with infection control. And so I'll just speak to that for a minute. All clinics have always had infection control protocols. And now is the time to really think through what your clinic, your pediatrician, family practice office has put in place. They all have protocols and standards of care in terms of infection control. And for infants in particular, there's generally a time of day when they're scheduling those well child checks to ensure that you're keeping your child away from other sick children in the clinic.
Absolutely. Actually, the clinic that
Mm.
we go to, there's a sick door and a well door. So
Yeah. Yeah.
depending on how well you're feeling, you go through one door or the other. And obviously, preparation is key. I know how it is just leaving the house with the kids at all, but making sure that you're prepared to make that visit is super important.
Yeah. So one of the preparations is really to determine what your pediatrician or family practice office has in terms of a screening questionnaire, always having your face mask for you and your family, all children over the age of 2,
Mhm.
having your own hand sanitizer and wipes so that you can do that sort of cleaning. But the clinics will have that as well. And just ensuring that you are aware of the immunization records that your child has. If you don't know that, pediatricians and family practice providers are very well versed in determining what that immunization record might be in the state. And I just kind of want to talk about how some families may feel like they don't want to go because they know they're behind. We do have protocols. The
Mm.
CDC has a very robust schedule for vaccine catch up. So don't, sort of feel like that's something that would keep you away from the clinic because you've been behind.
Yeah.
And that's a really good point because I think, many folks have put off visits over the past, 10 months out of fear for, their safety. And so being prepared is key for these visits. Also, it's knowing what to expect at this series of appointments. So whether you're starting out with your baby on this immunization schedule or you're jumping in mid-vaccination schedule, what can parents expect?
So we've created a website to help that amplifies the message of the Bright Futures and AAP guidelines,
Mhm.
uhc.com/children's wellness. And I'll say that again. But really, that helps provide, especially for that first 2 years of life. It's super easy to get behind within the first 15 months. There's at least 8 visits. And so for each
Mm.
visit, there's a checklist on what to sort of expect in that visit, what you might be talking about in terms of childhood development. As you know, infants from birth to age 2 have enormous growth in terms of not just physical growth, but developmental growth. And so, really having an understanding of what those developmental milestones might be, what your questions might be ahead of time so you can prepare
Mhm.
for the visit is really what this website has tried to do to outline it for
No
families.
question about it. And we're going to point people in the right direction. Again, it's on your screen. And Doctor, it's great to have you. We appreciate it. Thank you so much, and stay safe.
Thank you for joining
We're
us.
on the upswing. Things are
Thank
going to
you.
get better.
That's
Right?
right. That's
Yeah.
right. Thank
Okay,
you.
want to make sure. UHC.com/children's wellness if you want to learn more. United Healthcare, proud sponsor of the Morning Blend.